All right, hi. Thanks for joining us on a Sunday afternoon, evening. Most of you know me. I'm Jerry Burton. I'm the president of Nevada Now, and I'm joined by my board members. We'd like to make sure we introduce everybody, and I think all except for Lenore are with us today. So we have Tricia Methner. She's our executive vice president. Eva Love has been helping us with the program. She's vice president outreach and helps me with these programs. Vice President Madalena Robertson, she handles the media, the website, pretty much any graphics or, puts up with me all the time. And our youngest member, I'm so proud of. We also have Vice President, Kate, be ready for her list of things she does. Vice President, she's Legislative Action. She's also Nevada Now PAC Treasurer and Chair of the Legislative Committee, Sue Birch. Also, yep. My right hand. And Lenore Ingriley, she's our treasurer, long time, and she's on vacation, so she's not here today. Michelle Maese is our new secretary, and we weren't sure if you could join us. I'm so glad to see you, Michelle. She's been so busy there's a lot going on. So, and I wanted to mention before we get too busy that Eva's birthday is tomorrow. Happy birthday, Eva. And Madalena's birthday was a couple days ago, right? Saturday, was it, Madalena? Close. And I know that Trisha's birthday is coming up. So apparently we've got a bunch of birthdays on our board. So, and I don't see them yet. We were supposed to be, we have a couple young women who are starting a chapter at a high school, West Career and Technical Academy in Las Vegas. If they come on, and I was looking through the thing, I don't see them yet. They were going to come and tell us they had their first event at school, and they were able to sign up like 40 young women at the high school that want to be interested. They're calling it Loud Girls, and it's going to be affiliated with Nevada Now. We're mentoring and helping them get involved. So hopefully we see them today. But I wanted to make sure we introduce them if they get on. So Eva, keep an eye out for them. So, they said they would. And they're juniors, which is really cool. So Madalena will put some things in the chat that tell you how you can join Nevada Now. We're all volunteer, but there is a membership for now, and the money that's from the membership helps us with our activities. And then we also have our PAC that we can endorse candidates on the local level. National does on the Senate and the Congress level, but we can do all the rest. So that's what Sue and I'll be working on with Michelle. If you're running for office, make sure you send us a request for a questionnaire. We're working on revising the one from last time, and Sue and I'll be have that ready to go out. We're already having people request those. So just so you know, and we're always looking for volunteers for one of the things we're working on is our Nevada Menstrual Equity Coalition with Samantha Glover, working on period poverty in Nevada, passing the bill AB 224. And we know we have a lot more work to do in Nevada, so we're going to put together a coalition of groups that want to work on that issue. And I already hitting up Leanne McAllister. She was so helpful to us on our legislative committee, and we've talked about getting people, involved. So if that's something you want to help us with, we want to learn more about what is needed in school. Well, we know in schools, we've been working on that, but we need more. And also in prisons and the houseless, that these are areas we know Nevada really needs to work on. And Massachusetts now has a coalition, and they've been working together with probably 100 different organizations and people and hospitals and prisons to solve Massachusetts period poverty, and it's something we want to pattern after. And so that's one thing you can help us with. And then we're putting together a Nevada Quality Coalition, working on the state ERA that'll be on the ballot, but also with LGBTQ equality issues. It'll kind of be encompassing all those areas, and we want to work on getting organizations together with that. And then, of course, our PAC will be doing next year, endorsing candidates, as much as hopefully we're walking again door to door. We did last time, we did postcards, phone banking, and helped elect the wonderful people that we have in our legislature mostly. And this year we'll be looking at, Senator Spearman is always telling me we need to go all the way from dog catcher up. All over the country, there, we need to get some good people, progressive people into office. So we'll need your help with that as well. So lots of ways you can help. And we want to remind you to save the date. Our next meeting, we're going to stay with monthly for a little bit. During the pandemic, we kind of were going like every week, every other week. We're going to stick with monthly through the summer and virtual through the summer. And our next meeting will be Sunday, September 15th. We're going to have, right now we have 2 speakers. There may be more. And it's something I want to learn more about is the history of the Native American boarding schools. I have a couple friends. Mercedes Krause is helping me put together. She's with the Nevada Native American Caucus, and she has one of her grandparents had that experience in the schools. And my friend Cheryl Wapis-Amaze in Washington State, she's Tacoma Now president. Her grandmother was kidnapped and forced into one of the schools. And she also teaches at an Indian school in Washington State. So it's really fascinating to me. She talks about treaties and how, we probably could make 3 programs out of all of this, but that's what we're going to be talking about at our next program. So I think it'll be interesting, and it's something that I want to learn more about. So, and I see Senator Spearman's on, so you are going to go first, Senator Spearman, so hang on. And I was going to mention that Senator Spearman and I are going to Washington, D.C. Audrey and I were talking about there's going to be a ERA rally at the Supreme Court steps on Women's Equality Day on the 26th of this month. So we're going to double mask and head across the country. And they're going to live stream it on the ERA Coalition webpage, from what I understand. I'll go ahead and make sure that it's also on our Nevada Now Facebook page if you want to see what's going on. It'll be, I believe, 1 o'clock Eastern time is the timing for it, but I'll have more information about that if you want to tune in and see us on the steps. And I understand they've invited senators and congresspeople, and there'll be ERA activists around the country. So that's pretty much the update on what we've got coming up. I know Audrey's put some information about the event they're having that same day, later in the day in DC. So there'll be a lot going on the 26th. So I mentioned that because that kind of leads into our topic for today. When I've been talking to Senator Spearman about the ERA and, paid leave and pay equity, it ties together with the topic we have today and why we need the ERA. So, as most of you know, older women are more likely to live in poverty than men as a result of wage discrimination, low-paying jobs, caregiving, healthcare costs, domestic violence, and wealth gap. And half of Black and Latina seniors over 65 have incomes below 200% of the federal poverty line. So for women of color in this country, the wage gap affects their ability to retire and have money to save. And we need the Equal Rights Amendment so everyone's treated equally. And we're calling last year the women's recession. Women went through this, and because of a consequence of years of occupational segregation, kept them out of managerial positions, stuck in low-paying jobs, and few safeguards like paid sick leave that we worked on here in Nevada. So we need to educate young women. I've told a couple young women, I know we're working on senior issues today, but the way to solve some of these issues is to start with young people and young women and show them how important it is to have equal pay and paid leave and better job opportunities. So we've invited some amazing women from our community, and each of them work to help women and men in Nevada. And we'll be talking about ways to solve these issues, but also services that are available for senior women. And first, we want to start with Senator Spearman. She and I have talked about this many times, and it gave me the idea that we knew we had to have a program about this. And so I was hoping you would talk about, Senator Spearman, some of the things we've talked about, which is the pay inequality, paid leave, how that affects women going into their senior years, and why the ERA is so important. So thanks for joining us.
Thank you. And it's really good to be here. I thought I was going to be a little late and I'd have a chance to catch my breath, but thank you, Jerry. I owe you one, okay?
I owe you.
So, I want to pick up on what Jerry was talking about earlier about, we may be canvassing and going door to door. I don't know what the census will reveal in terms of percentages and numbers, but I would be willing to bet that there are probably more women of voting age in this state than there are men. That is important because when we have qualified women and we don't elect them, here's part of what happens. We passed in 2017, we passed pay equity. This last session, I had a diversity audit, a bill for a diversity audit that I was doing. I worked with Jan Jones and former Senator Becky Harris. You would not believe the pushback that I got from people about, tell me how many women are in your organization. Tell me how many women are in the C-suite. Tell me how many job positions you've had open. Tell me how many women have ascended to those positions. How long have they? I mean, the stuff that we know is happening, but it's not happening for us. And so the pushback was so strong. I got to think, I said, they must not be doing it right. Must not be doing it right, because if you're doing everything right, you don't mind someone asking you those kinds of questions. It's not invasive. People say, well, we can't, we can't be asking people. I said, you don't have to ask them. If you have an HR person, they know. Okay, they know. And all you have to do is just go and look at what you have. In your C-suites, how many you have. So here's why I say it's going to be very important to seek and vote for qualified women. Because unless we are in those positions where we're charged with hiring, especially in government jobs, it just won't happen. It won't happen. This is not a commercial for me in terms of running, but I just want to say this. When I become mayor of North Las Vegas, and I'm running real hard to do that, that diversity audit is one of the first things that I want to do. It's one of the first things that I want to do. The more women that we have in those positions, women in municipal government, women in county, and more women in state, where we have an opportunity to make those decisions, that's how we pull the pay equity out of just statute and put it in reality. Right now, it's still aspirational, and now we've got to make sure that we can realize what we passed and what we worked on so hard. And when people talk about, well, why does the ERA matter? The ERA matters because as long as we are not paid equal to our male counterparts, we will retire in poverty. We will retire in poverty. And the people that keep saying, well, states have laws and so we don't really need the ERA. No, we do need the ERA. We need the ERA because it's got to be about our constitutional rights and making sure that in every aspect of our lives, we're showing people how important this is. Some people look at it and it's just ethereal, but we have to show people that there are some tangible things as to why we've got to make sure the ERA passes. Pay equity is one. The other one is making sure that housing is available to senior women. We don't have enough affordable housing anywhere in Nevada. But if you think about the housing insecure, and then you compare that percentage-wise to the women who are, and I'll say 50 and older, I will guarantee you that that number is exponentially higher than it is for men. And hold the phone, because the other part that we've not talked about in terms of people retiring in poverty, we're talking about the L part and the T part of LGBTQ. Retiring in poverty because for many of them, when they were young enough in their working years, especially our trans women, in their working years, it was very hard to find a job, very hard to find someone who would hire them. So now we have women who are aging, but we also have women who are aging and they're part of the LGBTQ plus community. Up until 10 years ago, you couldn't adopt kids. You couldn't, they barely let you babysit them. You didn't have a family, you couldn't get married. And so there are a number of people, women, who are not just retiring in poverty, but when they retire, if they get sick, they have no one to care for them. And so we have to be very, very careful about what we do and how we do it, because what we do today, in many instances, it will reflect, whoever the youngest person is on this call, it will reflect on your retirement. The 401k is important because once you put that in, then it starts growing. They put it in a portfolio on Wall Street that is managed by a hedge fund person, and it grows. If you are 20% less than your male counterpart, guess what happens when you retire? It's not just 20% less, but sometimes you wind up with a retirement that's like 40% less. It's important for us to pay attention to our older women. Nobody has ever proved me wrong on this statement. And the statement is this: if you don't die young, you're going to get old. Right? And so it would behoove you, even if you're not looking at Social Security, to make sure that we're doing the things that are necessary for the people who are retired and those who are retiring. So let me just put all this in a capsule. 2022 is coming up. And I don't say vote for just any woman. I'm not saying that. I'm saying find qualified women who have the same values that we have, qualified women who believe that, you know, if it's your choice to wear a mask, it's also your choice for reproductive services. Hello. Qualified women who understand that just because we passed a pay equity law doesn't mean that it's there, but qualified women who will ascend to these positions. And when they hire people, they will hire qualified women. That's how we do it. That's how we do it. Make sure that you're letting people know we fight today so that our parents and our grandparents and even us, we can live a quality and safe life in our future. That's why we fight. That's why we don't stop. That's why we keep going forward. And that really ought to be our battle cry. We're doing it for today. We're doing it for tomorrow. And tomorrow and tomorrow and all of the tomorrows after that. We have got to get busy. That's all I got. That's all I got.
Well, that's just perfect. We can go home now. Thank you so much. Thanks for getting us started. So next we have Christine Hess. She's the executive director of the Nevada Housing Coalition. And we know, Christine, that housing insecurity is a problem for seniors, as Senator Spearman was talking about, and we have a shortage of affordable housing in Nevada and around the country. And with prices of homes going up and rents going up, we know that's getting worse. So we want to hear maybe some of the solutions you have and things we should be working on to help, and also what's available in Nevada. So thanks for joining us.
Thanks so much, Jerry. And Senator Spearman, that is a very hard act to follow. You said everything that needs to happen, and it needs to happen now, no doubt. So really appreciate that. I'm not wanting to kill everyone with a slideshow on a Sunday afternoon, but affordable housing does have some numbers in it. So I'm just going to share my screen and go over a few slides with you all. Jerry, you can see that thumbs up? Awesome, great. So first, thank you very much. I'm Christine Hess with the Nevada Housing Coalition, and we're a statewide nonprofit, and our work is to advance and promote affordable housing for all Nevadans. So that would definitely include our senior women. And you're going to see how our work really, and especially as we go forward, we're really targeting our efforts on those who need affordable housing most. We advance our mission through 3 strategic priorities: education, advocacy, and collaboration. So we have a monthly lunch and learn. We'll be having an annual conference, hopefully in person. That is still currently the plan, October 27th and 28th in North Las Vegas. And we have a variety of members, public, private, local government, so advocates, community service providers, so really the gamut. As we know here, housing is central to our success in all the other sectors, right? It's central to our ability to invest in our own health, our education, to own our own business, have that dream. So I just want to real quick talk about what is affordable housing. Because affordable housing means something different to everyone when we say housing is affordable. But affordable housing actually has a technical definition. When an individual or household pays more than 30% of their income on their housing costs, that housing is considered unaffordable. And housing, of course, is for our household expenses, the largest share of our expenses. So again, when we're paying on our housing, we are not paying on the other things that we need. And also central to this conversation, when we're paying too much for housing, our ability to save for that retirement, right, is so much less. And again, as we age and become seniors, gosh, Senator Spearman, I wish that weren't true, but I guess the alternative is also not good. We're going to be older, right? So I'll take getting older over the alternative. But if we're not able to save, we really struggle in our retirements going forward. And if our housing expenses are too high, not only do we struggle, but we could be at risk of homelessness. So I also like this one. Who needs affordable housing most in Nevada? And this is really important because there is a great need of affordable housing for too many here in this state right now, just as Jerry talked about the rising costs of rent, the rising costs of home prices. It's just really out of control right now. But again, when we talk about paying more than 30% of our income on rent, the chart on your right, this shows who is cost burden, paying 30% or more by income level. And as you can see, really all incomes in Nevada have some share of cost burden relative to their housing. They're paying more than 30% of their rent. Now, that said, if you'll notice on the left of the chart, 92.4% of our extremely low income, 84.9% of our very low income Nevadans are paying more than 30%. And in the extremely low income, and really again to this conversation today, 81.5% are paying more than 50% of their income on rent. When you're paying more than 50% of your income on rent, you are not, you're lucky to hold your job. If you have a car, can you put gas in it sometimes, right? I mean, that's how extreme it gets. The pie graph on the left, again, for today's conversation is really important. And you'll see that seniors represent 30% of our extremely low income Nevadans. And I don't know the breakdown for women. We can get that for Nevada Now if you want that. But again, as Senator Spearman said, definitely there's a large portion women. And I think this is another important fact. And I really appreciate, Jerry, how you talk about your younger members, and Senator Spearman, same thing. I like this statistic to think about women in Nevada who are struggling or who need help to make it, especially relative to housing. For housing choice voucher holders, so Section 8 is how many of us may think of it, but essentially getting a subsidy so that you don't pay more than 30% of your income on rent. In Nevada, housing choice voucher holders, 77% are female head of households that hold voucher holders, that are voucher holders. So while they may not be seniors, they will be seniors. So we do have a women population that needs some support. How much more affordable housing do we need? Because I hear this all the time. We need more affordable housing every conversation I walk into. We actually have a deficit of more than 84,000 units of available and affordable housing. Now, remember, it doesn't mean that we have 84,000 people who are homeless, but what it does mean is people are paying too much for their housing, and they really can't afford it. And in a pandemic, they're at risk of homelessness, right? We're one crisis away, let alone 15 months of a pandemic of those facing severe housing insecurity. So I know that sounds big and heavy. Unfortunately, I wish I could say we could wave a magic wand, or if only we did this, then that would happen and we would be okay. There is no silver bullet. It really is a collaborative effort, and that's the work of the coalition. We don't disperse the money. We're not even the decision makers. We just bring those together that do hold the purse strings or are the decision makers to help advance affordable housing for all Nevadans. And you can see here, I like this slide, but it kind of shows you, first of all, let's keep in mind the number one person would be those we serve, right? Those who are low income. We want to make sure that all Nevadans have access to affordable housing. But it kind of just shows you all the players at the table and how we all need to work together. So the coalition does definitely work on policy, which I heard in this group is something this group is very interested in. I'm just going to touch a little bit on our 2021 session. We led efforts on 5 bills, and I did see Assemblywoman Marzola earlier on today. So thank you, Assemblywoman Marzola. She was awesome and carried AB 331 for us, which was a hard bill. 3 of our bills did not make it, but 2 did, and they are definitely significant bills. And as we all know here, it's a work in progress. Talk to the opposition, and we'll be working on the initiatives still going forward. And I think, as we come out of the legislative session, one of the things, my biggest takeaway, it was my first Nevada legislative session, was the opportunity. Right? To me, the opposition really was more just opportunities for more and better conversations because we have to come to a solution. No is not an answer. I also want to leave us with this and a call to action for this group. So there is a lot going on in affordable housing, even though the session is over. We are poised for progress, and I really do mean that. Again, no silver bullet, but these are 2 opportunities for financial resources, which affordable housing is expensive. That Nevada has and that this country has in front of it. So the coalition right now is leading a group of 70 stakeholders, and private, public, again, those same people opposing 334 and 331 are at the table because they do care about Nevada too. And so getting their feedback in this plan is very important, but we're getting ready to release our recommendation to Nevada leadership, which will have a significant investment in affordable housing. And again, I want this group to know, really important, our recommendation will definitely be for affordable housing, including multifamily development, but it will be targeted. We are looking to set aside for at least 20% for those below 30% area median income and those that need permanent supportive housing, so really exiting homelessness. So that's a really exciting new initiative. So keep your eye open for that, and you can all participate here if you haven't gone to NevadaRecovers.com. And once you see our recommendation, hopefully you'll voice your support. And then if you have ideas, for example, make sure we get housing for senior women, put those in. I strongly encourage it. I feel positive that our Nevada leadership is listening. Additionally, the budget resolution that is in front of, that just passed through the Senate, has $360-some billion in housing and transportation provisions. So keep your eye on how that moves forward, because that could have some significant impacts on Nevada as well. But yeah, a lot of technical information. I don't want to go too much in the weeds, but I'd be happy to participate in any questions going forward too.
Thank you so much. I think we'll have, if you have questions, put them in the chat. Sorry about the voice. One of the things I was going to say, Christine, is as you have that information, together, we put the link for the NevadaRecovers.com in the chat. Maybe you could send it to us. Maybe there's actions we can take, people we can make phone calls to or send emails to or whatever. We like that kind of thing. So keep us posted on how we can get involved and help push that through. That sounds like a good action item. We like to have positive things we can work on. So thank you so much. And again, we'll do some questions towards the end. Thanks so much. And I wanted to have Venicia Considine to come on next. She was on the Women's Democratic Club meeting the other day talking about some of the eviction information for people who are, in trouble and might get evicted. And she works for Legal Aid Center of Southern Nevada, if I got that right, Venicia, and has some information for us, an update on what's going on in Nevada with eviction. So I thought that would be good to do after we were talking about housing. Hi, Venicia. Thanks.
Thank you, Jerry, and thank you. It's always great to see everybody here. And I've heard Christine Hess talk multiple times on housing, and that number that we're in the negative gets bigger every time. So I'm definitely interested in doing everything that I can for housing. Part of housing is being able to afford rent. And one of the issues that we are working with at the Legal Aid Center of Southern Nevada is this sort of tsunami of evictions. When in 2020, during the height of is there a height of the COVID pandemic? I don't know, but during a portion of the pandemic, when we were just talking about eviction moratoriums, there were estimates of up to 300,000 families ending up homeless. And I think the moratoriums and the CDC declarations, that's cut down on a lot of money through the Chaps program and other rental wraparound services have helped a lot of people as well. But this keeps lingering on. So we don't know how long it's going to go. The state moratorium ended. The legislature passed AB 486, which gives a lot of protections to tenants if they, are getting an eviction notice, if they know that they are going to be unable to pay their rent. And then we heard a couple of weeks ago that the CDC put out another moratorium. And one of the things that we see as a challenge is for people who are not familiar with Nevada's eviction process. When they hear the word moratorium, they think, okay, moratorium, that means it stops. That means that I'm okay, I cannot be evicted. But that's not what it means. The CDC moratorium itself, in certain courts in the state, they've made the decision, or they are functioning on the idea that AB 486 gives more protections than a moratorium. So people who are being evicted from their apartments or whatever rental situation they have, that are being evicted for, let's say, something different than a non-payment of rent, are still being evicted. So I appreciate the few minutes I have here to just kind of let everybody know that we're in a situation for any renters that if they're in danger of anything, it's sort of the belt and suspenders, do everything. So for example, I sent Jerry a lot of flyers. So definitely want to be aware of that. And I think she's going to share those. To begin with, in Nevada, we have what's called a summary eviction process, which is different than it is in just about any other state. What that means is your landlord or somebody on your landlord's behalf can tape a notice to your door. They can hand it to you. They can get it to you in any other way. That's actually the beginning of the eviction. It could have lines that are not filled out. It doesn't matter. That still means that your eviction process is started. It's typically a 7-day pay or quit, which means you have 7 days to either pay the rent or file a court case. And this is where it gets a little weird. In any other state, usually your evictions go through a court system. But here, that taping on the door, that 7-day pay or quit, if you don't do anything, the next knock at your door is going to be the constable giving you a 24-hour move-out notice. As a tenant, you must proactively file an answer with the court, which is very weird because usually the defendant or the person who's filing the answer isn't the one who starts the case. But in evictions, they are. So if you're a tenant or you know anyone who's a tenant, they get the eviction notice, any eviction notice. There's a few things that they want to do. One of them is to fill out that CDC declaration anyway. Even if someone is not sure that it will protect them, you fill it out anyway. One of the documents that I forwarded is in the attachment, but all of these things that I'm talking about will be available or are available at lacsn.org. They're available at the Civil Law Self-Help Center. And we also have pop-up clinics and folks helping people fill all of these out. So one, fill out the CDC declaration. You want to attach that to your tenant's answer. 2, choose mediation. If you elect mediation, that means that a landlord, the tenants, a representative of the tenants, if they have an attorney, the landlord or their representative has to get together and discuss ways to resolve whatever the reason for the eviction is. So let's say that you're behind on rent. Okay, if you have applied for Chaps funding and you have answered and AB 486 then protects you, that means that they cannot evict you until you get an answer from Chaps. But that only happens if you get in front of the court. So you have to, again, file that answer. So you file the answer, you attach the CDC declaration, you apply for Chaps if your eviction is for not payment of rent, and you elect mediation. So there's sort of 4 steps for this. That will give you the best protection possible, and it'll give you the time to find out whether or not you can get Chaps funding that pays your back rent for up to a year. You can get wraparound services as far as if you are in need of utility assistance. If you're in need of any social assistance, that will help as well. Then when you do go to court, you want to tell the court, if it gets to the point that you're ending up going to court, you want to tell the court that you have a pending CHAP application. Even though it should be, with your answer, you want to notify the judge. Let them know if you've been approved for CHAP, but your landlords refuse to accept it. That is a valid defense as well. Some landlords don't want to accept the funding. I don't know why, but if they can, the idea behind this is landlords are made whole, tenants remain in a sheltered location during a pandemic until they can get back up on their feet. We still have the highest unemployment rate, I think, in the nation. So all of these things working together.
And I wanted, Venicia, I have the email, but I wasn't sure which ones to put up. Do you have them handy to put up what you think would be appropriate? Just so we have it on also in the video for people to look at.
Try and put the links in the chat, because I could probably do that easier.
That's great, yes.
Okay, because it's quite a few of them. So I know I've said it already before, but if you're a tenant, anyone who potentially is worried about facing eviction, have them apply for rental assistance before they even get anything on their door. Sign the CDC declaration before anything happens whatsoever. Respond to any eviction notice immediately by filing an answer with the court, and elect mediation in your answer as well. And through all of this, ask for legal help. Legal Aid Center has an eviction prevention program that we sort of put together when COVID happened. We have advocates, we have attorneys, we're triaging. Anyone who calls, you'll get to talk to an advocate. They'll give you all the legal information. The pop-up clinics or at the Civil Law Self-Help Center, someone will help you fill out your answer. They'll work with you and go through the whole thing. You can do it electronically and file it automatically. So if you wanted to try to do it from your home, it's all available online as well. There's help out there. If it is a pretty egregious case, right now with our current staffing levels, we have attorneys help with the most egregious cases and be with you in the courtroom. So there is help out there. I'll put the links to all of this. Including there is an eviction prevention clinic on Saturday, August 28th between 10 a.m. and 1 p.m. at Desert Breeze Community Center. Anyone can go in there, ask for help, get information, fill out paperwork, all of that. Thank you so much for your time.
And I just put the link for that one because I was looking it up on the website. So thank you.
Thank you.
And I always know you have a lot of information. So any links you can put in there, we can include in an email as well for people. So thanks, Venicia, for taking time. It's so important. So
thank you.
So our next speaker is Dina Schmidt. She's the administrator at the Nevada Department of Health and Human Services in the Aging and Disability Services Division. That's a lot, Dina. So I know you have information for us for what services are available and the programs. And, again, if you have any action items we can take, or that's what we like to do. So thank you for joining us, Dina.
Absolutely. Thank you for having me. I really appreciate it. What a great group of women. And I feel honored to have the opportunity to meet with all of you. So I just really want to go over start with a few things. First, I want to kind of talk about the data. What's it look like in Nevada? And then just some considerations, and then a review of some of the resources. So Nevada has had the highest population growth for the past 6 decades, and then the second highest in the last decade. So we have continued to outpace every other state in the nation. but especially in our aging population. Those 65 and older, we've increased by 57% between the years of 2008 and 18. We also have a higher rate of individuals who are Hispanic and Asian compared to the national figures. And in Southern Nevada, the rate of individuals with limited English speaking is nearly double the national average. And interesting, the male-female difference, we actually trend a little bit lower than the national average. So we're pretty close on the national average there. When it comes to the labor force, and this is something we've all been talking about this whole meeting, right, is you can see that only 72% of the labor force is women, with 83% men. Oops, sorry, I apologize. My little mouse got ahead of me. And then there's a breakdown of the ages, and you can see, as you would expect, people tend to drop out of the labor force as they age. And here's an interesting slide and a sad slide, and it's exactly what Senator Spearman started talking about, right? What is the difference in wages between men and women in Nevada? Men outpace women in every category. This is fascinating for me, except construction. I can't understand how women outpace men in construction. I found that quite fascinating. And then the other notable difference was in agriculture. The difference is almost 50%, really quite glaring in certain fields more than others. So what does that mean for women? Really looking at the poverty rates in Nevada and comparing men to male to female, and you can see there's quite a gap again, especially as we get older. More women, a larger percentage of women are living in poverty. For all the reasons that we discussed earlier, right? Not spending as many years in the workforce, oftentimes, and the wage differences. Social Security benefits for Nevada women. Here's the average monthly benefit for the United States, actually, is quite a bit different. You can see that it's about $300 a month for retired, another couple $100 a month for those workers that retire with disabilities. And the only place that women have a higher average retirement benefit from Social Security is those widowers, which makes sense since women do outlive their spouses oftentimes, meaning they collect that additional benefit. So unfortunately, in order to be equal, we have to actually have a partner pass, which is not really good news for us. Leading causes of death for women in Nevada. You can see here heart disease, malignant neoplasms. I do have to admit that I had to look a couple of these up. So if you have questions, cerebrovascular is blood flow to the brain, or also strokes was one of the top 5. And you can just see that surprising heart disease is one of the largest ones. So things to think about for us as we age in Nevada. Nursing home care. Nevada has more retirees moving here than in most other states. We also have a lot of folks moving to the state and away from their families. So they lose that support system. So oftentimes they end up in nursing facilities or needing that additional care from some other outside entity. 50% of the people turning 65 or older are going to need long-term support services at some time. That means most of us are going to need it one way or the other. Almost half of all personal care aides are between the ages of 45 and 64. And of those personal care aides, that workforce really is predominantly female. More than 8 in 10 of personal care aides in Nevada are women. And within those women, that 83% of women who are the workforce, African American and Asians are overrepresented. So the bulk of that, they are the highest representative group providing nursing home or home care for folks. And people of color make up 33% of Nevada's population, but 44% of personal aid workforce. I'm not sure if any of you are familiar, but the Gwynn Center did a study on the impact of this crisis. There is a personal aid crisis right now, direct support. One of the bills that passed through legislation this last session, I think it's AB 344, correct me if I'm wrong, but it really created a home health care workforce board, which is really an exciting opportunity to look at the wages of personal care agents and personal care attendants across the state and try to build in some equity. SB 340, I apologize, was the bill, which is really going to be critical. I mean, this is an area where women tend to be the caretakers, and we rely on this workforce for all of us, for ourselves and our loved ones. And so trying to make sure that that workforce board is able to bring light and funding to wages of this workforce will be critical. So if there is an ask, I would say, is just watching that development and supporting those efforts and making sure that this critical workforce is supported, male or female. Really, the need in Nevada for personal care services is already in a crisis mode right now. We're already hitting a crisis. In our agency, we're seeing folks not showing up to appointments, people being left at home with no one showing able to care. The coronavirus has made it worse. Our agencies can't hire anybody. They put out ads and nobody's even applying. People aren't showing up when they do apply. They just don't even show up to work. So it's really becoming concerning across the state. So a few things I just wanted to, planning for aging, and I think it's critical. In my prior career, I was actually financial advisor for Morgan Stanley here in Nevada. And it's been interesting to bring some of that experience to this job and realize like there's so many things that people just don't look at and consider. As Senator Spearman said, we're all going to age. And there's so many simple things that can be done to help your family, help your loved ones, help yourself. If your parents are still alive and they haven't done all these things, have the conversation, right? Half the time it's just having the conversation. Make sure that you have a power of attorney in place. Make sure you've done your estate planning, whether that's via wills, trusts, advanced directives. Make sure somebody knows what your desires are. Don't wait until it's too late. I just had a sister-in-law, 43 years old with 2 small children, had 3 brain aneurysms and a stroke, right? You never, ever know, right? And what her family has had to go through because they've never had the conversation could have been avoided. You know, you could make a horrible situation a little bit easier if you just have these conversations. Think about on a personal level, does somebody know what living arrangements you want? Do you want to live at home as long as you can? Do you want to go to a group home? Do you like the idea of a senior community or a nursing home? You know, some people thrive in that environment because of the socialization. Others have no desire whatsoever. Make sure somebody knows. What are the plans if you can't drive anymore? How are you going to get transportation? Is your house accessible, right? Do you have a 3-story house and all the bedrooms are on the 2nd and 3rd floor? What's going to happen when you lose your ability, you know, to ambulate up and down those stairs anymore? Do you have a plan? Think about those things. Think about your preferences, and let somebody else know and write them down. And I know we heard from Venicia, there's all kinds of legal services available to help people. There's online services. There's, you know, lots of ways you can get help doing these things. Some of them are very simple ways. I think about when we used to call it the poor man's trust, right? A lot of times you don't need a trust, and I am not giving legal advice. Don't get me wrong. I don't want to get myself in trouble because I'm not an attorney, but things like joint tenancy and transfers on death, you can do deeds, simple things that can make the transition of your assets a lot easier for your family members without having to go through the court systems and taking years and going through that and creating the havoc that we've all seen when it comes to losing a loved one. Understanding your healthcare options. You know, Medicare has come so far, but I have to say, is probably the most complicated system I've ever had to deal with. I had to call the SHIP to help my stepmother. We operate the SHIP program in my agency, and I had to call and get help because I could not help her navigate her Medicare plan. So understand, do your research. There's lots of great resources out there, understanding the difference between all the Medicare Advantage plans and the options within there. There are lots of free services. The state does operate the Senior Health Insurance Assistance Program. We can help you enroll and answer questions and walk you through the enrollment process and do a comparison of your plans. Resources that are out there in Nevada. This is just a small picture of just what the state resources are. There are so many community providers, county resources, city resources, multiple nonprofits. We fund a lot of the nonprofits in the community to provide some of these services, and others we provide ourselves as the state. Nevada 211 is probably the most underutilized resource there is. Simply go online. If you can navigate pretty well by yourself, or your loved one can, I would say Nevada 211 is the easiest place to go for information and referral. That's exactly all it is. It's information and referral. They don't hold your hand. They don't walk you through the process. Their job is to give you the information that you needed, what are the resources in your area, and you go find them and pursue them. If you're having difficulty or a family member is having difficulty, the next level of help that you can get really is Nevada Care Connection. That is an options counseling and resource and service navigation. So they can do an assessment, talk about your needs. They do a lot of education about long-term care planning and understanding what the options are. And it's really about helping people make educated choices about what their options are. And then if you need that little extra help, they can make the calls on your behalf. They can assist with applications. They can follow up and do case management for somebody who's struggling to get connected, because sometimes the paperwork gets a little bit confusing. And so that's what Nevada Care Connection really is all about. We also have community advocates. If you have folks, their primary job is to increase awareness in the community about all of our programs, but they also have the ability to help in an emergency situation. So they have some funding pools. If a person is facing eviction, is facing power shutoffs, they can one-time money. Oftentimes we help people with one-shot emergencies to get them back stabilized. So they have a lot of ability to help navigate. They will also help fill out applications and direct people within their communities. We have the Office of Consumer Health Assistance, another small but mighty team who help individuals advocate on behalf of their health care. So if you have someone who's having a billing issue with the hospital, they don't understand, they can't get access, they can't get a prior authorization for a specialty service, they have a rare disease and no doctor will take them. These guys do amazing work advocating on behalf of individuals. They also do the surprise billing that was passed. This is the team that does the arbitrations. So if somebody receives an out-of-pocket expense for an emergency, they are the ones that provide that service. But really they're there to help people navigate any problem you have in your healthcare system. They have contacts within the Social Security Administration, the Veterans Administration. I have seen some heartwarming stories. I probably get more thank you letters from consumers about this group than any other. I probably get no less than one a month, because they take the impossible situations and make them possible for people. So long-term care ombudsman program, if you have a loved one who's in a facility, living in a nursing facility, a group home, any type of residential facility, this group can go in and they basically advocate for the resident. If they're not happy with the food, if they're not happy with their schedule, they're not getting to eat when they want to eat, they basically educate the resident about their rights and help advocate to make sure that they are living in an environment that's meeting their needs. And then Adult Protective Services, the one group that we hope we don't ever have to come across, but unfortunately, in our Adult Protective Services, we find that women, definitely about 60% of our cases are female women, and so we investigate abuse, neglect, and exploitation. That's what ANE is. I apologize, but it would not fit on my little graph. And so that group will go out and do the investigation and work with law enforcement if necessary to alleviate the circumstances and make sure that the individual has anything that they may need. So like I said, this is really just a kind of a high level, but there's resources from that lowest level to the highest level and everything in between. I think so often what I see is people don't know about us until they need us, and then they don't know where to go. So my job is to try to educate folks and get out and try to get the resources to advocate for ourselves and let people know where we're at and what we're doing. We have amazing resources and amazing teams that are willing to do anything to help folks. So if you have any questions for me, I'm here. My contact information is on here. You are welcome to email me anytime, any questions. If you want any additional information, brochures, that type of stuff, by all means, just let me know. There are links here to the Nevada Care Connection site. You can also go to our website and find resource information as well.
I was dropping a few of those. I was looking at the site and dropping a few links in the chat. So thank you. Yeah. there's a lot of information. I know several of us have had recent, not just are we aging, but our parents are aging, and
Yes.
we've been helping them. I had to do that with my mom. She was losing the ability to communicate, and we luckily got a lot of things in place knowing we were heading down that road with, with her disease she had. So I appreciate what you're saying, because it's not just for ourselves, but also for our parents and then for our kids. I want my son to not have to worry about those kind of things. And as I hopefully age, the alternative is good. I do want to age. So
Exactly.
thank you. And I know we'll have a few questions, so hopefully you can hang on and we'll
absolutely
get to that. So thank you. That was a lot of really good information. So, I'd say we saved the best for last, but we've had so many wonderful people. Jodi's been such a big help to me putting together our program today and talking about some of the services they do at 3 Square. So Jodi Tyson is with us. She's Vice President of Strategic Initiatives of 3 Square Food Bank. Is that right, Jodi? But I know you're working on a senior program and with food insecurity for seniors and what 3 Square is working on. So thank you so much for all your help with these wonderful speakers, and thank you for joining us today.
It's really been my pleasure, and it was great to work to help put this panel together, and then also just as a member of NOW and the work that we're doing in the community, and just making sure that we are all banding together for the progress of women in healthy communities. So this has just been a really great treat for me. So I'm going to share my screen. So I'm the Vice President at 3 Square Food Bank, and I do have, I don't know if you can all see that, so let me move that out of the way. I do have the privilege of running the Strategic Initiatives Department at 3 Square, which is basically our targeted populations. So we have a department that looks at targeted health for our community, including seniors, children, and households that are eligible to participate in federal nutrition programs, but are not currently participating in those federal nutrition programs. So that could be energy assistance, SNAP, which is the new word for food stamps, if anyone's more familiar with that. We also make sure that more of our kids are participating in school breakfast and school lunch and after school meals and summer meals and things like that. But we also have all these programs that are great for seniors, such as our congregate meal programs for seniors, which we have around the valley. And we receive funds from ADSD, from Dina's group, to help us make sure that we not only talk about congregate meal programs in our community, but we actually run a congregate meal program and in North Las Vegas right now. And then we also look for those populations like seniors who are less likely than any other age group to participate in SNAP. And so we really want to make sure, particularly women who are seniors, know that these programs are eligible for them, and then also to help kind of demystify some of the things about these programs to kind of help to take away the stigma for applying for programs. And then also thinking about the misinformation that's out there, such as that seniors only get $15 if they apply for SNAP, because if they're on Social Security, they only get $15. That's actually not true. In Nevada, in one study that we did before the pandemic, the average person who was 60 and above was getting nearly $70 a month. And if you were over that age, I think it was over 70, then that went up as well. So it's a good program to be participating in. When 3 Square wanted to really look at senior hunger in our community and what we could do to make a bigger difference in senior hunger, we went to UNLV and spent some time with them looking at a study that we could do just for Clark County, because there is national information about senior hunger, but we didn't really know what Clark County looked like. And with more than 70% of the state's population, and also looking at the fact that we have unique challenges in Southern Nevada, as we have talked about, where seniors may retire in Southern Nevada, leaving their family members behind. What are some of those above and beyond circumstances that maybe other communities don't deal with in the way that we do in Southern Nevada. So we wanted to really delve in and look at the issue of senior hunger. We did, through UNLV, 1,002 interviews conducted with older adults. 339 of those were in zip codes that have at least 15% food insecurity. And then 663 additional interviews were done in census tracts across the county. The study participants were majority female, and also majority having a disability. And then there's also some demographic information that's below about the composite of the participant pool. And I just want to say that there's a couple of limitations. We always want to have data-driven decisions that we make in programs, but we also want to understand our limitations of how we look at this information and data. And so one of those things is that we do know as a community that seniors may be less likely to participate in interviews, right? And so when people call, you have to have a working telephone number. It has to be a telephone number that was somehow listed that we could buy a list from. And so if your telephone number is changing a lot, or if you didn't want to participate in a survey, then we weren't able to capture an interview with you. And so some of this demographic information relates to who was willing to participate in our study as well, right? And who we had good telephone information for. The goal of the study was to look at a couple of things. Number one was, if not food, then what? So what do people have to have spending trade-offs with the income that they do have, that fixed income that seniors have? And we consider a senior to be 60 and over. So some of our seniors are still working and others are not. So within those spending trade-offs, the number one thing that came up was medical care and medicine, and then utilities and utility assistance, and then transportation and housing. So if not having enough money for food, what are either some of the, like they're redistributing money that maybe would normally have gone to food for other expenses, or what else are they also struggling to pay the bills with? And then the second thing was, what is the impact of fixed incomes? So the median income range of the participants that were interviewed with us was between 35 and 50,000. And one of the things that we found is that their weekly budget shortfall, because of those spending trade-offs, and because we know that people with disabilities and people who are aging who have medical concerns or take prescription medication have above and beyond expenses that people who are healthy and younger do not. And so the weekly budget shortfall increased from where on average anyone in Southern Nevada who experiences food insecurity, $16 per person per week is the budget shortfall. So if you ask the average person on the street, how much more money would you need every week to be able to buy all of the food that you needed so that you didn't have to worry about food and that you knew that you could have 3 healthy meals every day all week? It was $16 per person. When we talked to seniors about their budget shortfall, it was $62 per person per week. So the impact of food insecurity is even greater for those that are seniors and living on these fixed incomes. The third goal that we wanted to look at was how many seniors are actually homebound and who are they? So we found about 17% in total of the seniors that are within our participant group, which is statistically allows us to extrapolate that for the whole county. So about 17% of seniors are homebound and in need of home delivered groceries. And then females with a disability were correlated the highest with being homebound and in need of home delivered groceries. So 3 Square actually started our Golden Groceries program several years ago. And we have found some really great things with our Golden Groceries program, but particularly we've been able to use information to help us drive better decisions about how we can create eligibility for certain programs, how we make programs accessible to us. And of course, we always want to be including seniors, particularly senior women and women who are, or seniors who are living independently, which in many cases are senior women. Because they outlive their partners. Golden Groceries locations, we actually look to making sure we have 5 quadrants in Clark County at 3 Square. We call them regions. And so we look at those regions to make sure we have coverage for all of our types of programs within each one of those regions. And so we do take a look at the map to try to find partners who are great partners for us to work with. And I just want to identify a couple of those challenges because we always come back to the research. And one of those things was transportation. There's a pretty sizable population of seniors who do not have access to a grocery store within a half a mile to their home. So we try to make sure that we are in food desert areas for seniors, and we work with our agencies to become an agency partner for Golden Groceries. So the food comes into the food bank, and then we distribute that food to those agencies who are right located in those neighborhoods that can help seniors. Now, I think that this is a statewide group, and so what we're talking about specifically in Clark County, you can see the map here is North Las Vegas, the Enterprise and Paradise area, and then Henderson is what you see on this map here. But this kind of approach, in essence, is also carried in Northern Nevada. They also have a government commodities program that they work with seniors, and they do the same thing. They bring food into the food bank, and then they distribute that food to agencies to make sure that that food is accessible in neighborhoods. One of the great partners that we have had in working with seniors has been our apartment complexes that are providing low income or affordable housing for low income seniors. And that way, those seniors have a pantry that's right on site. And at first, we thought, well, is that a priority population for us because they are at least already receiving affordable housing? But those folks are also struggling with transportation and being able to carry bags back to their homes, right? So at one place that we had a pantry that was had the nice groundbreaking and a ceremony there, and I was talking to a couple of those ladies, and they said, we are so excited about this pantry because we would take the bus 2 bus stops to Catholic Charities, which was the closest pantry to them. And even though it's a great pantry, it has a lot of dignity in that pantry because it's like a grocery store and you walk around with your grocery cart and you choose the foods that you want. We had to carry all of that stuff back from the bus back to our apartments, and it was a lot. And we were very afraid of going through the homeless corridor. And so we would all wait until we were out of food, and then 3 or 4 of us would go at the same time. And so we really have found apartment complexes that are catering to low-income seniors to be a good partner for our Golden Groceries pantries. But we also do have a home delivery program component to this. So we'll talk about that in just a second. But is Golden Groceries working? So now we've been doing this program for about 3 years, and during the pandemic, we really ramped up our home delivery program. And you'll see here some good feedback from seniors about being able to increase that access to fresh fruits and vegetables, being able to increase that access to lean proteins. We have a purchase program at 3 Square, which allows us to buy this food and bring it into the food bank. And the best part about really some of this is those lean proteins, because it's really expensive for the food bank to buy lean proteins. It's really expensive for you to buy lean proteins, right? And so, so we are very grateful for the generosity of the community and to a particular anonymous donor that gave us sustainable funds to make sure we always have money for food for our senior population. And then these are some of the quotes that we had from seniors who we interviewed as far as taking a look at whether or not our program is making an impact. And the one I love the most is like, it's like getting an increase of $100 a month in my Social Security benefits. We also had a program I won't talk about too much, but we do have a real focus on healthcare partnerships. And this really is to look at how do we partner with healthcare, because if you're homebound to us, that means you don't leave your home more than about once a week. And oftentimes when you do leave your home, that once a week, you're going to a doctor's visit. So it's really important to us to make sure that we have interventions that are tailored to healthcare partnerships so that we can identify when people are with their healthcare providers that they are experiencing food insecurity, so that we can really make sure we have a tailored intervention that happens right there. So at UMC, we had over 1,000, about 1,300 seniors were screened for food insecurity before they were released from the hospital. So they were admitted patients to the hospital before they were released. They were screened for food insecurity, and then if they were found to be food insecure and they wanted to opt into the program, then we actually delivered groceries to their home within 24 hours after that discharge, so that we could take a look as to whether or not we were making a difference in the readmissions rates of seniors that were going back into the hospital. And also because we wanted to take a look at whether or not we were connecting unconnected seniors. So seniors who had been experiencing food insecurity, but that had not participated in services in the past. And what we found, and I just want to shout out again to Dina, because part of this grant was through funds that they actually provided. In this grant, 486 seniors were referred to the food assistance program. And then it was 36% of those we found to never have participated in other types of benefit programs in the past. So we were really connecting unconnected seniors. And I just really quickly want to take a show. We talked a little bit about transportation and making sure that we have place-based services, talking about some choice, client choice, making sure that seniors have the ability to go in and choose foods that they like, and that we have a variety, and it feels like a dignified experience where you actually get to choose a lot of the foods that you want. We are about to unleash our Golden Groceries website, unveil our Golden Groceries website, and this is an opportunity for several of our agencies to work with us so that information gets into the hands of seniors who want not only choice in the foods that they are eating, but they also want choice in how that is provided to them. So in Golden Groceries, you'd be given a code. You can go in, it's like going into an Albertsons shop. I will tell you, for one thing, I have been buying my groceries online for the last 18 months, and I hope that that's a service they never get rid of, because I like ordering my food at 11 o'clock at night and then just driving up curbside and knowing that I can just have somebody come out and bring it to me. It's fabulous. So our Golden Groceries website is a way for seniors who are participating in our program to go on. They can click on to the foods that they like. And then my favorite part about this right here is if you see a recipe here that you like, and all of the ingredients for that recipe would be part of our program, you can actually hit this button right here that says add ingredients to cart. And then all of that goes right into the cart, and you don't even have to look around for those things. So one of the feedback from seniors is that they don't want to cook anymore. They don't want to spend a lot of time in the kitchen anymore. And they're not cooking for huge families anymore. And so we want to make sure that our programs fit the needs of the of seniors that we're talking to, and especially senior women who are living on their own, during this time, or even senior men who don't know how to cook, right? Who never had to worry about it. So all of our menu options are really simple things, and we have all the ingredients that comes right with that. It's all based on a point system, so we know that people also want to be able to choose cookies sometimes, or soda, or things like that. Those might be a little bit more points, so it incentivizes healthier eating, but we try to make it really easy. And then when you close out, you can choose, I want pickup, I want delivery, and then that way we could be very flexible to the needs that our seniors have. Our priority areas include this congregate and community meal opportunity. We know that seniors are aging differently now. It used to be in the greatest generation of our seniors, they love to be able to get together for congregate meals. Kind of our younger seniors, not so much anymore, right? But there are ways that we can adapt congregate and community meals to fit the kind of things that seniors do love to be able to do. Getting together through their church community, or getting together through the VFW, those are the kinds of communities that like to come together to still talk and to have fellowship together. Our healthcare partnerships, our transportation, mobile pantries and near home deliveries, which are at apartment complexes, and our home delivered groceries in rural areas. So these are all on track for us as we continue to improve upon this program. And I will just say as I close, because you should never have a presentation without that great call to action. And so if you have seniors that you think would benefit from a program like this, please have them call the 3 Square Center. That's our call center at the food bank. And we actually have just a couple of questions that we ask seniors. We try to plug them into a place that's close to them. But if they prefer home delivered groceries, or they are really burdened by transportation issues or mobility issues, then we can get them on our home delivered list. And that telephone number, and I'll put it in the chat too, is 702-765-4030. And just another quick second about, I'll also take a page out of Ellen Spiegel's book recently, who said, don't ever let an opportunity pass by without saying, I am running for Henderson City Council. And part of the reason why I am running is because 45% of households in Henderson have at least one senior who is 60 and over. And so part of our ability in our communities to have sustainable development is to think about the needs that our seniors will have 10 years, 20 years from now, so that we can be the kind of community where people can continue to age and live in our community, whether that be helping with the crisis of home care health providers, making sure people can age in their homes, as well as making sure that we have enough assisted living programs and community living programs for seniors as they choose to be part of something different than independent living. And so these are things that are really important to me as a person, and I think that I bring some experience to this conversation that doesn't already exist in terms of experience on our city council. So thank you all for that little plug right there. I appreciate it.
Thank you. It's good to have candidates attend Nevada Now meetings. We love that. We get to know you, and our members get to know you. So, and I know we're going to have some questions. I wanted to hit on 2 little things before we do. I've been kind of jotting some of the questions down, and Eva usually helps me with that. If you could hang on for a little bit longer. I wanted to ask Michelle if we covered, may I say, if we covered SB 340, you and I talked about home health care and how that's a piece of any topic about senior women. Did we cover that pretty good, Michelle, or do you want to?
Yes.
On SCI?
I'll just give a couple more updates, but Dina, thank you so much, because I was cheering you on, if you could see my face in the chat and over here when you were speaking. So thank you so much for the opportunity. And it just falls in line with everything that we've been talking about. SB 340 is the Nevada Home Care Workforce Safety Standards Act. And what that does, and you are so right, Dina, people weren't showing up for work. They weren't, they didn't feel like they had dignity and respect in the workplace. Our home care workers make $9 an hour. This is a national campaign that SEIU started across the country, because our PCAs, personal care assistants, they are majority women, majority minorities. They are not treated like they should be, and they are essential workers, just like anybody else that worked in this pandemic. They really care about their family. They call their clients that they work with their family. And a lot of them, and thank you, Jodi, for talking about food insecurity, would go into the homes and see that their families had no food. And they would have to call and go get groceries and, go above and beyond what they were normally said to do to ensure that they had adequate living conditions for their families that they were taking care of. This bill gave the home care workers a voice, gave them a seat at the table with the HHS, with a county commissioner, to make sure that they had transportation reimbursements. A lot of them on $9.50 an hour have to pay for their own gas. They have to pay for their own training. They had to pay for their own PPE. I don't know about you, but I don't know how they did it. It was almost impossible for them. And so, a lot of people, like everyone has already said, Nevada is rising with seniors that are moving to Nevada to retire. We have 13,000 PCA workers in the state of Nevada. And the majority of them really, really love their work, but it's really impossible for them to do their work on those kinds of wages. So this workforce board will give them a seat at the table. It will give more transparency to where those Medicaid dollars are going, to get some more reimbursements, because that was the problem. Far too long, there's been little transparency with public dollars and what they're being really allocated for our frontline workers. So this is really going to look into that. And, thank you, Senator Spearman, for talking about the 401k and for, just the money piece of, what we need to keep an eye on, because, I don't know about you, but the majority of the women that I work with and we have served and our clients don't understand that, because they weren't the head of the household, whether it was domestic violence and there was money insecurity, and they weren't able to, do their bills. And we find this a lot with the PCAs working with the elderly people that they're working with now. So this will strengthen their workforce. This will give them paid sick time. When they take time off, they don't get paid for it. And so then they're having to recover, and it's really been a hard impact for them. So again, this bill was sponsored by Senator Neal and Senator Ndiaye, and we also went and lobbied with Senator Spearman, and she gave them such a great pep talk. That was a rough day for all of them. I don't know if you know this, but one of the PCAs that she cared for passed away from COVID, like the day before, and it was like such an emotional day for all of them. And Senator Spearman gave them a really great conversation, a really great talk, and they went out there and they just did such a great job. So, thank you, Senator Spearman. It's been, and Assemblywoman Thomas is on here as well. It was just a really, really great legislative session across the country, especially here in Nevada for our home healthcare workers. So we appreciate Nevada's now support. Jerry testified, a couple other people testified, so we made it happen and we're excited. What Dina said was, please watch the bill. They're creating the workforce board now with DHHS. So in the next couple of months, we will make that happen. And when Senator Spearman becomes mayor, we look forward to that. And when Jodi Tyson becomes city council, and when I become president of SEIU in March, because that's what I will be running for, we will continue to make sure that women are on the front lines helping each other succeed. Thank you.
Thank you. Thanks for taking time. I know you were busy today, so I was glad to see you could hop on. And we're going to get to questions next, but I just wanted to, I texted Maya and Morgan and said, I hope you're joining us, and they are here. These are our young students who are, they are going to tell us about, just kind of real quickly, girls, let's talk about what you did on Friday. And we're just so excited to have them getting involved with students in high school, and I'm glad you could join us. Hi.
Hi.
Because young women, that's why I told you, I know we're talking about senior women, but young women need to be listening to this. So thank you for joining us.
Yeah, thank you for having us. Yeah, we pretty much, for last year, I had a PBL where we could pick any topic that we wanted to talk about, and I picked the patriarchy, of course, and I was just immediately inspired. And so I decided to make a club out of it. So I got a teacher, and then I called up my friend Maya, and then we made it happen. So this year it's finally a club. And on Friday we had an activities fair where during lunch we talked to all the grades and stuff. And we got over 40 signatures of people who want to come to the club, and 80 likes on one Instagram post of just a poster board. And I'm super excited. Tomorrow is our first meeting. So I'm a little nervous, but I'm super excited about it too.
Well, I'm super excited for you, because I know when we first talked about this, you were afraid maybe 2 people would sign up. And so 40 is pretty amazing. And so then you can be the leaders that we talk about all the time and get young people involved. So
yeah,
thank you so much. Thanks,
it was
Maya.
definitely more than we expected to sign up. So it's pretty exciting that many people are interested.
So they'll be looking for speakers. We'll be helping out with that and topics, and so anything we can do to help out, you let us know.
Definitely, yeah. The first meeting, we're going to just do a little introduction, but we're looking for volunteer opportunities, speakers to come in to us to talk about specific topics, because you even want to learn, have books to read, movies to watch, just articles to read, just all that stuff. So if you guys have any thing that you'd want us to show, I'm all ears. I'm super excited.
We'll have lots of ideas for you, so I'm super excited too. Sue's doing the happy dance. We're so excited for you. So
Me too. I'm super excited. I'll let you guys know what happens tomorrow.
it's going to be great. Okay, so let's get some questions, and I know we're almost to time, but we had some in the chat. Eva, did you see anything in particular that you wanted to bring up first?
He asked, what if a senior doesn't have a computer or know how to use it? Can they call in their order?
I think that was for Jodi with
Yes, Jodi.
Yeah, so that's a great question. We have given this website to our agencies, so when they're ready to actually enact it, then our agencies will be able to do that. If they, for some agencies, it may only be computer-based, and we'll help triage people to get them to those agencies if they're only going to do it on the computer. But there are some agencies like Helping Hands of Vegas Valley who actually use senior volunteers to come to their facility so that they can answer the phone, and they actually teach them how to use the website. And then those seniors help the other seniors walk through all of their choices and put their list together, and then that's how their list is created. So definitely there'll be a hybrid of some of those different types of agencies, but part of that is because we actually do need more volunteers to be with our agencies to help with getting this up and going. And so keep in mind that I'll probably be bringing more information back about ways in which seniors can volunteer in the future too.
And that was my question, Eva, while you're looking for another question. How can people volunteer to help at 3 Square? I know you need volunteers. I know you need donations. How does that work?
Yeah, well, actually, September is Hunger Action Month, so we're about to start in our traditional month of raising awareness about the funds that we do. We always say, 3 meals is $1, so if you can donate $1 to the food bank, that's awesome. But I will say, in terms of our senior hunger program specifically, we do pack produce at the food bank that goes out with our Meals on Wheels programs with Catholic Charities. We actually have some things that are pre-packed for our home delivered program at the food bank, so you can volunteer in our volunteer room for those kinds of activities. You can go onto our website. It talks about all of those volunteer opportunities. You fill out just a short form application to be a volunteer, and then you can choose the types of things you want. So when you choose produce, by and large, right now, produce is all senior hunger stuff. So feel free to choose that. If you do for home delivery, that's all senior hunger program stuff. And then we also love to have seniors, and we're just now starting to open up the opportunity again, is seniors who come in to learn how to fill out those federal applications over the phone. And then we actually help people apply for benefits over the phone. And the reason why we love when seniors come and volunteer at the 3 Square Center to help with applications that are done over the phone is because, like I said, we're really trying to reach seniors who are unconnected to benefits that they are eligible for. And so when they actually get to talk to another senior, it's really helpful and meaningful. Plus, it's a great way for people, whether you're a senior and don't have as much mobility anymore, or you're a person with a disability of any age, to volunteer at the food bank. It's a great way to volunteer.
That's wonderful.
Thank you.
Fabulous. Okay,
Yeah.
There's another question. How many times can you apply for Chaps?
So I think that's for Venicia, if you're on there.
I think if any, you know what, I don't know that off the top of my head, but I can find out and email you, Jerry. I would assume that if you've applied and you've been denied and any circumstances change, then you can apply again. If it's a situation where you've applied, you've gotten funding, let's say last year, or now you're in the same situation because it's things are still going on, I think you can reapply for that, but I will get that information and email it to you tomorrow. It's a good question. Thank you.
Perfect. Thanks. Yeah. And any questions you have, if you didn't catch maybe an email, you can always send something to me, just jerry@nevadanow.org, and I can get information from our speakers, and we'll have links and things that we'll put on our website. Madalena helps me do that with some of our programs. We'll have links. We should make a whole section on this, Madalena. That would be a good spot on our website. So, Eva, do you see anything else we need to cover?
No, I see a lot of wonderful comments, though. Boy, I tell you, this this chat is just brimming with good information.
Well, and I think it'll, again, we can put this on our website and people can go back and watch the program and get information, and we can add the links. And I really think this will be a good piece, a good addition to information we provide to the community, and what great speakers we have today. And I want to make sure that you stay in touch with Nevada Now with me, so that we can, as you have different programs, going on, or we can add to the information that we can provide. We want this to be an ongoing relationship with all of you. So, Jodi, you're not getting away from us and we know you'll be sending in for your questionnaire. So we're working on candidates as well. We love when people come and we get to know you. So it's wonderful. Sue, is there anything else we talked about with the PAC that, we've talked about how to send in the questionnaires for candidates, since we were talking about, we've got a couple candidates on our program today.
Yeah, just be patient, because we are working on the questionnaire. We probably won't get it out to you to the end of the year, because I know the filings are all due in March. But in the meantime, we are going to be doing something as a fundraiser for the PAC. It probably won't be in person. We're trying to come up with something fun to do online in a Zoom meeting. So be just on the lookout for that.
Yeah, and how much, I know the figure, I know you know better than I do, but how much money did we give out in our PAC last year to candidates?
$8,300.
$8,300. Okay, so we want to top that, but that was our first year of having a PAC. So, and a lot of the wonderful women and men who were elected, we really worked on all those campaigns. So there you go. So unless somebody has any other questions, feel free to if we missed something that you had a question about, and I say email me, or most of you have my phone number. Let me know if there's something we need to cover. I think we could have had a whole other program about and had other people come and speak, but it was great to meet all these wonderful women in our community, and what a great program, and thanks so much for taking time to join us today. So if you want to, and we usually say, if you were at a meeting, then we would all just say goodbye and chat on the way out the door. We used to meet at the library and actually see each other. So any parting words of wisdom, Senator Spearman?
Stay masked. It's no joke. Stay masked.
Stay masked.
Thank you.
Stay masked. Get the vaccine if you haven't already. So, yeah. I'll come and take you down there myself. If you need transportation, I'll give you a ride. We need vaccinated people. So,
and we all have our gorgeous Now masks, our pink.
Yeah, well, and then we're going to be taking our ERAS masks. Senator Spearman has her pocket square. We'll be wearing our ERAS
the green ones
masks.
too. Yeah.
Yes, in front of the Supreme Court. So we'll be carrying those with us. So. Thank you so much for joining us. It was a wonderful program, and I think we learned a lot. I know I did, and thanks so much.